I'm Mary Herod. I'm the CEO of the New South Wales Users and AIDS Association, NUAA. Our head office is in Surrey Hills in Sydney, in the Acon building, where we're located with a number of other community organisations. NUAA is funded by the New South Wales Ministry of Health, and we're part of the larger HIV bloodborne virus prevention response, which includes other community groups such as the gay community, HIV positive community, and sex workers. We're a statewide organisation, so we have a fixed site NSP on Crown Street, where we are now, and we also have outreach services in southwest Sydney. We have a website which distributes resources to people statewide, and a publication called Users News, which goes out to across the state. NUAA has a variety of services, but the key thing about them is they're all developed and organised and run by peers for peers. So they target on people who inject drugs, and it's focused on preventing bloodborne viral infections like hepatitis C, B, and HIV. So they're broadly education, direct harm reduction in distributing clean injecting equipment, and improving access to health care is another key focus. So engaging people who are often very marginalized and reluctant to come into health services, engaging them at a peer level, so somebody that you can trust and believe what they're saying because you know that they have the same experience as you do, and in that way giving people access to the health system in that way. NUAA is really focused on health as a human rights and the human rights of what I think is one of the most marginalized communities in Australia. What we're trying to do in NUAA today is continue the work of their founders, which was to have good access to health care as a basic human right to people that use and inject drugs.
My name's Opie, and I'm a prevention officer at NUAA, and I coordinate the Outreach NSP program. Outreach at NUAA is a needle and syringe program that delivers to the southwestern suburbs of Sydney, and that includes areas Campbelltown, Liverpool, Fairfield and Cabramatta. So this runs 4 days a week, and we have built a client base that can contact us personally. They don't have to give a name. We can meet them where suits them, as long as it's a safe area. And we provide everything at our fixed site in a mobile setting. So as far as delivering outside of Sydney, we can refer people onto other organisations that can, that can provide them with what they want. And also we are looking at extending our current outreach network beyond. Some of the resources we have at NUAA include our well-known magazine Users News, which is written for people who inject or use drugs. It's distributed statewide, including throughout prisons, and it's free, and it's available throughout most NSPs across New South Wales as well. It contains a lot of articles written by people who use drugs, a lot of health information is provided, and as well that sort of feeds into the website from Users News, which is usersnews.com.au, so people can access the paper version or the digital version. Our NSP also has resources available that are specifically tailored for people who inject drugs and are designed to prevent the transmission of bloodborne viruses, especially HIV. So this includes, for example, wheel filters, which are really good for people with lower suppressed immune systems, and we stock those here at Crown Street. People don't have to pay for our services. We are a completely free service. People to access our service just have to walk through the door, and someone will be here to help and serve them. As well as that, we're a completely confidential service, so people don't have to give their name, they don't have to provide any information. It's nothing like that. It's just walk in and come and get what you need, and yeah, simple as that.